Welcome to the Ty Beal Show, where we discuss food, science, and life. I'm Ty Beal, a scientist at the Global Alliance for Improved Nutrition, or GAIN. My guest today is Dr. Carlos Monteiro, a Brazilian epidemiologist who coined the term ultra-processed food and developed the NOVA classification system. Dr. Monteiro is an emeritus professor at the University of São Paulo, where he has been for 50 years. In our conversation, we discuss the origins of the NOVA classification system and where it's headed, and the new Lancet series on ultra-processed foods and human health, released today. A quick note before we start. This podcast is separate from my role at GAIN. Okay, let's get started. Dr. Carlos Monteiro, welcome to the show.
Thank you, Ty.
I'm really excited to have you on. We'll discuss not only the origins of NOVA, which is the classification system for how ultra-processed foods are currently defined, but also the launch of the new Lancet series on ultra-processed foods and human health, which will have just launched today as this is published. So to start off, could you tell us exactly what are ultra-processed foods?
Yeah. So, first of all, let me tell you that one interesting background of this. The issue, the relationship between food processing and health is more or less obvious, right? But if you go to PubMed and you ask about papers that had food processing, processed food, and health or chronic diseases, you'll find just a few papers until, let's say, the last 5-10 years. Now we have more than 3,000 papers, but for many decades you have just a few. And so this is interesting because, I mean, we could ask, why is this, right? Why food scientists and epidemiologists ignore this obvious relationship for so long time? So as regard the epidemiologist, I think the explanation I have is food processing is very complex and is very technical. And so epidemiologists say, no, I don't understand all these. It's too technical. And it's complex. So how we could, what aspects of food processing, etc. So as regards food scientists, I don't know what's the answer, but one answer is that most of them work for the UPF industry, right? So, and I starting to respond to you, what are ultra-processed foods? They are novel products. They are not junk foods, because junk foods is something, is a poor quality food, right? Contaminated, or, I mean, very gross imbalances. No, ultra-processed food uses sophisticated technologies, right? And this requires food scientists and food labs, etc. So, but I mean, so we realized this in the maybe 15 years ago. We realized that it was obvious that this relationship was important. And we realized another thing. By our group works with, we are epidemiologists, most of us. So we work on the relationship between diet and health, right? So then you had this epidemic of obesity. In Brazil was not different. And actually, this creation of NOVA was done in the middle of our efforts to understand what would be the causes of the epidemic of obesity and diabetes and other chronic disease in Brazil. And empirically, we start to look for changes in the diet that were parallel to the increase in obesity, right?
Mm.
So then we realized that we realized we had some novel foods in the food supply, and those were the foods that were increasing, right?
Right.
Apparently, they were very different because I mean, we had soda, we had instant noodles, we had some frozen meals, ice creams, and chocolates and snacks, and so apparently this was a heterogeneous group, right? And they were in terms of a nutrient profile, for instance,
Hmm.
but they had the same in common. They had these most were novel products. They incorporate a lot of technology, and and they were designed in a way to substitute traditional foods. So then we realized that for, let's say, for traditional pasta, you have instant noodles, right? For, let's say, meat dishes, you had nuggets. Of course, for water and fruit juices, you had soft drinks, all types of soft drinks, energy drinks, etc. So then, two things were important. They were novel products. They incorporate a lot of technology, and they were designed to compete with traditional foods. So that and another feature was that they were made by transnational corporations.
Hmm.
So, and because they involve technology, and because they involve technology, they add value to the product. So then they were very profitable.
Right.
So as you see, there are many things in common regarding UPFs. So then we defined it initially ultra processed foods as formulations because actually you have many ingredients.
Hmm.
Processed food, traditional processed food, you have two, three, four ingredients. But I mean, these formulations, you can easily have a 10, 20, 30 ingredients, and those ingredients, again, different from processed foods that you have. Always you have a main food. I mean, like in cheese you have milk, right? Or
Right.
bread you have wheat flour. In the case of UPFs, you have many ingredients, and they were engineered in a way that they could compete with traditional foods, and they could maximize industry profits. So this is the conceptual definition of UPFs. But of
Yeah.
course, I mean, you don't do research with this UPF, with this concept, right? So then
Yes.
we went to operational definition.
That's excellent. So let's just summarize here. These are not just junk foods because you're saying they're very sophisticated. They involve a lot of technology and there are a lot of formulation involved in this process of these foods. So you set out decades ago when you noticed and you recognized this really rapid increase in obesity and chronic disease in Brazil and other places. And you thought, what's going on? What is driving this? And I like that you made this, you distinguish between traditional foods and these novel products that are intended to replace them. They're cheap, they're made with refined, extracted ingredients, cheap ingredients that can add a lot of profit for industry. They're also heavily marketed, right? That's another piece of this. And you said transnational corporations. So we moved from this food system, this food supply, where a lot of the foods were freshly prepared, processed, but with just a few ingredients, most of the food intact. And we completely transformed very rapidly to this ultra processed food environment. So now let's talk about the definition and how do you identify these for research or for policy. Okay. Can you tell us now, how do you identify this? Because this is a big challenge. How do you really identify what is this ultra processed food?
Right. So we spend years discussing this because uh, we wanted to have something operational and replicable, something
Right.
that people could do the same in every place. And then we decided to look for in the list of ingredients of these UPFs what was common, what and what ingredients were essential to the business model of UPF. So then we were not interested to select the ingredient, the worst ingredient, or the ingredient that would be the main mechanism that explain why they are unhealthy. No, because since we define UPFs based on the purpose of food processing, then we decide to look for ingredients. Without them, making UPFs was almost impossible, right? Uh,
Mhm.
because they don't have whole foods, and they don't have whole foods because whole foods are expensive and they have a short duration, right? So when you do a formulation with protein isolates and starches and fats, oils and sugar, that then you have a long duration product by definition, right? Uh, and because you don't have the whole foods, you have to have these other ingredients. Part of them, of course, are sugar and fat, and these are probably the most important components of UPFs. But processed foods, you also have oils and sugar, right? Uh, think of canned foods or cheese. Always you have or sugar or either sugar or salt and sometimes oils and fats. So these were not specific of UPFs. So, and then next we say, but there are some specific things that are used to replace whole foods, which are modified starches, high fructose corn syrup, hydrolyzed protein isolates, all these things that you don't have in your kitchen, right?
Mhm.
So UPFs essentially are formulation of ingredients, not whole foods. These ingredients include ingredients of processed foods. Then we were not interested on this because they won't be able to distinguish. That then we came to these food substances of no culinary use or of mostly industrial use, right? So
Mhm.
this was one of the markers. And the other group of markers are the cosmetic additives. And again, why UPFs needs cosmetic additives? Because they don't have whole foods. And because they don't have whole foods, they don't have color, texture, flavor, anything interesting. On the contrary, I mean, when you put together protein isolates or deodorized oils, I mean, the idea is to make thing insipid, something without any taste, particular texture, etc. So, but nobody would buy this, right? So then comes the cosmetic additive. So flavors, colors, texturizers, thickeners, emulsifiers, artificial sweeteners to replace sugar, um, several processing aids that you need to make this thing uh, palatable or edible or often hyper palatable.
Mhm.
And this is another important thing. When you formulate a product like an UPF, you can make anything. I mean, with modern technology and modern ingredients, you can make anything. I mean, you can make a cookie with a taste and flavor of almonds without almond. you can make, I mean, like instant noodles that you have palm oil and starch, and then with flavors you transform these in delicious noodles. So the business model of UPF is making products with a very low cost, therefore highly profitable, and at the same time very attractive. So that's essentially the business model. And it's a business model that never could exist 100 years ago because
Hmm.
we didn't have all these advances in food science and technology. So operationally, we decided that ultra processed foods could be identified, not exactly defined, but identified by the presence of markers of food ultra processing, which are essentially these food substance of exclusive industrial use or cosmetic additives.
Right. Okay. Super fascinating how the thought process behind that. And I want to dig into some of the controversies because Nova and ultra processed foods have come under a lot of scrutiny over the past year, especially. One of the most common critiques that I hear is that not all ultra processed foods are unhealthy. And there are plenty of unhealthy foods that are not ultra processed. So if you've heard that, how would you really respond to these critiques?
Yeah. So, first of all, let me tell you, in the Lancet series, this was there's one panel in the first paper of the Lancet series where we put together the main criticism, but not all the criticism, because then we made a distinction: scientific criticism and those that were raised by the industry just to disqualify the concept. But
Right.
okay, so then we respond to four criticisms. One of them is this one. UPF is a very heterogeneous group of foods, and they are not equally unhealthy. So what we say, yes, 100% true. Uh, but what we then develop is the idea. So they are not equally unhealthy, but how we could rank them in terms of healthiness? It's complicated because, for instance, if you take a soda, right, a carbonated soda, and one flavor yogurt, right, a fruit flavor yogurt, both are ultra processed foods because they are made of these food substances of industrial use. So in the case of yogurt, you have modified starches, you have protein whey, and of course you have colorants and flavors, etc. Right? Um, of course, they are not equally unhealthy. Right? Soda is, I mean, there's nothing worse than soda.
Right.
Uh, but a ultra processed yogurt is less healthy than a plain yogurt with fruits. Right? So, at the same way, of course, soda is less healthy than water or fruit juices, etc. So, if we want to know how food ultra processing affect different food groups, we need to compare one UPF, the UPF version of some food categories. So then cookies or yogurts or bread or cheese, anything with a with the non-UPF counterpart. And nobody did this until
Mm.
now. So we don't know. It's very likely that the the UPF yogurt is not as unhealthy compared with the yogurt than soda with water or fruit juice. But we don't know actually because but based on the composition, we could say that an UPF version of any food category is less healthy or is potentially less healthy than the UPF version. And uh, the evidence linking UPFs to ill health is is the dietary pattern, right? So we know that the diet is healthy or unhealthy. Individual foods, I mean, it's difficult to say what is healthy or unhealthy because it depends on the rest of your diet. So
Right.
the evidence shows to us that the ultra processed diets or diets with high amounts of UPFs, they are related to dozens of diseases, right? And what is the mechanism? The mechanism is that the ultra processed diet is made of different components, UPF components, that are replacing non-UPF components. So then what we have in this case is an additive effect. So the association between ultra-processed diets and disease is because you do the wrong substitutions, right? So you substitute plain yogurt with fruits by fruit flavor yogurts, etc., etc., etc. So that's why, and this explains why some reanalysis of cohort studies sometimes they show that some individual UPFs like yogurts or whole wheat breads, they sometimes they have a neutral association. They don't have an association, or sometimes they are even beneficial. But what these studies they do, they compare, let's say, the fruit flavor yogurt or the whole wheat ultra processed bread with the rest of the diet. They don't compare with a plain yogurt with the real of whole wheat breads. And
Right.
and we know that it's very difficult. You need, in this case, yes, you need a randomizer control trial because I mean it's almost impossible to control confounding. Usually, people that consume yogurts, any yogurt, ultra processed or not, these people usually consume fruits and vegetables. I mean, so that it's almost impossible. And in nutritional epidemiology, we know this for years. I mean, that if you want to study an individual food is very difficult. Really, in this case, really, you need a clinical trial because then you are treating food as a drug.
It doesn't stop
Then-
researchers from doing it, though, Carlos. We see a lot of cohort observational studies doing exactly what you're saying, is comparing a food group to the overall diet, right? And teasing out an effect for, let's say, yogurt, breakfast cereals, and whole wheat bread. Where you're saying this really takes a randomized clinical trial to do this comparison with a similar food group that is minimally processed or at least not ultra processed, right?
Yeah. But one interesting thing is that based on food composition and nutrient profile, you can rank UPFs, right? So then you have two situations. So in low and middle income countries where UPFs are still not the dominant food, uh, these reformulated UPFs or these healthy subgroups like fruit flavor yogurt, they are one way the food industry uses to penetrate in the market, right? Um, so in this case, for these countries, I don't think it's useful to distinguish different UPFs. I mean, the idea is to promote traditional diets, minimally processed foods, cooked meals. This will have to do. If you take the US or UK, a few countries where the transition is over and UPFs dominate the food supply, you can start by, let's say, think in terms of taxes. I mean, it does make sense to tax all UPFs because you'll be taxing 70% of the foods. And this simply doesn't work, right? So in this case, you could base it on not on the epidemiological studies because they are flawed, but base it on composition. Then you could select some UPFs and start with these. So the concept of UPF subgroup, it can be useful in some specific situations, but the selection should not be done based on this analysis of cohort studies because they are completely flawed.
Mm-hmm. Have you talked to Walter Willett about that?
A lot.
So I just
but,
want to
he,
summarize.
but he doesn't listen.
Okay, so I had him on the show, a month or two ago. So, and we talked about the Eat Lancet, and he, he, of course, many of his studies are cohort studies, and his sort of take was really it's the sugar sweetened beverages. Those are the main thing that are driving, which I think least controversial food group. But I agree with you that we can't really depend on cohort studies or observational studies for these. I want to reiterate something you said in contexts like countries where they have not fully developed or not economically are not producing and consuming ultra processed foods as the majority of their diet. The approach of trying to maintain traditional foods and limit the increase and prevent the increase of all ultra processed foods makes sense because there are alternatives, right? There are these traditional foods that are already there being consumed. In a context like the United States, the UK, other higher income countries that have usually English speaking, that have very high quantities of ultra processed foods, you need to go and not just address all the ultra processed foods, but get more specific. But what you're saying is don't use the cohort studies to guide that. Go in and use some nutrient profiling to really understand what are the worst offenders. Now, soda, easy one, right? I don't think there's much debate there. But then you got a lot of other nuance on the edges.
You summarize perfectly what I think about these. And another aspect I think is important is the idea of dietary pattern. So we all know that is the overall diet that is healthy or unhealthy, right? So this means it's the dietary pattern which is healthy or unhealthy. So when you take the Mediterranean diet, which is a dietary pattern, all the components of the Mediterranean diet are equally healthy? Of course not. I mean, you have olive oil, you have fruits and vegetables a lot, you have fish, you have potatoes. So then, of course, that they are again, but it's the same thing when you compare one component of Mediterranean diet with, let's say, the Western diet, oils or or staple foods or I mean always you have less healthy alternatives out of the Mediterranean dietary pattern, and I never saw anyone asking about this, right? So that what is the secret of Mediterranean diet? Is the olive oil or a fish or fruits or wine? Or because it's a dietary pattern.
Right.
So the problem is that people don't accept those people that criticize UPFs. They, in general, they believe in the idea of dietary pattern. They defend the Mediterranean dietary pattern, but they don't admit that we have an ultra processed dietary pattern. And why
Right.
is that? Because in theory, they are not the product of a food culture, but they are. They are because then, if we think about the control of the transnational corporations, the control of the global food supply, they are the ones that are pushing this dietary pattern.
Mm-hmm.
So I admit that it's not so clear. It was not clear for me. I mean, this idea of UPF as a dietary pattern is something that we developed during many years discussing, etc.
Right.
Because, so that's another point, important point.
Right. People seem to have a lot more grace for other dietary patterns, but for ultra processed foods, there is an expectation that you got to have all the unhealthy foods and none of the non healthy foods. So
Yeah, and interesting because people tend to see dietary pattern as something positive, right? So then,
Right.
and then when you see this is interesting. It's usual. I mean, you see the Western dietary pattern or the Western diet. There's no definition.
Right.
It's a circular argument. You say the Western diet is unhealthy, unhealthy diets are the Western diet. So you
Hmm.
really don't have. So what we did with Nova was to define two dietary patterns. So one made based on group 1, 2, and 3,
Right.
and Mediterranean diet, I mean, Latin America, African, Asian diets, you always find fresh foods. You have many minimally processed foods. You have culinary ingredients that are different from place to place. And you have some processed food, some simple processed foods that
Hmm.
are foods that, products that in theory you could make in your kitchen, right? You don't do, but you could, because they are made with ingredients that you have in your kitchen. So,
Right.
and then the other dietary pattern, which is opposite to this, is the ultra processed dietary pattern based on. So Nova has this quality of defining two very important things: traditional diets and the ultra processed diet.
Right. That's a huge. I think there's a huge distinction. Important that you are actually identifying this traditional type diet or a wholesome dietary pattern, which people have no problem with saying. The Mediterranean diet is relatively healthy. The DASH diet is relatively healthy. But when you define the unhealthy dietary pattern, which is ultra processed foods, the modern food, the standard American diet, right, the SAD diet, then there's a lot of backlash. So I really appreciate that distinction. I want to hear some of these other criticisms in the Lancet series first paper you mentioned. We talked about at least one of them. Are there any other criticisms that you want to raise here that you can address for us?
Yeah. So I think the first one in the panel we have in the Lancet series is about um, the difficulties to identify UPFs, right? Uh, and but this is most the problem of in terms of research, right? So
Hmm.
if you take most cohort studies, they use food frequency questionnaires, right? We know that these food frequency questionnaires, they were designed years ago, when the UPF concept didn't exist, right? So then, in the case of UPFs, you have some groups in the food frequency questionnaire that combine UPFs with non-UPFs. Uh, so this is clearly a problem for research. And a solution for this are the new food frequency questionnaire, and there are many already, 3 or 4, that were designed to having Nova in mind, right? So this is,
Hmm.
but it's true that all these old cohorts, they don't have these. And then what we have is that a small proportion of, because in most cases it's very easy. I mean, if you have a soda is UPF. I mean, you don't need to. If you have a fruit or vegetables or I mean any culinary preparation, then it's not UPF. But then you have some. Let's take bread for instance, right?
Hmm.
So in some food frequency in most food frequency questionnaire, you have bread. I mean, you don't have many qualification of bread. So in this case, what people that do research, epidemiologists are familiar with this because it's very common that you don't have the data that you want to have, right? So,
Right.
and then what you do sensitivity analysis. So you take these, let's say, DAB items, and then you put in one category or in another category, and you rerun the analysis, and you see if you get a very different result. And when you see most of the studies, including the Harvard studies, And the Harvard study systematically, because we helped actually the Harvard people to do the studies on UPF, the nurses cohort and health professionals. So what we do is to select a group of foods that we are not 100% sure if they are UPF or not, and then we do the two types of analysis. So in a way, we recognize that this is not easy, but then we have to specify in other situations, like say, this is for research, but then you have dietary guidelines, right? So in dietary guidelines is easier because then the markers of food ultra processing works very well. So then not just the Brazilian dietary guidelines, but guidelines in more than 10 countries. What they do is they tell consumers, look for the list of ingredients. If you see something, some food substance you don't have in your kitchen, or if you find colors, flavors, and all these cosmetic additives, it's very likely this is ultra processed, right? So then, in this case, I don't see a big difficulties. Then you have regulation. Regulation is more complex because in regulation, you can have, let's say, a regulation saying using the markers, traditional markers of food ultra processing. So in this case, and you have this situation in the US now with this FDA consultation, and we submit one suggestion for the consultation, saying that maybe in the case of the US, you have to rethink about the markers and reduce as much as possible the markers to 4 or 5 ingredients that are easily recognized, and then you use this as a way. So we recognize that it's not easy because UPF is a complex concept, and the way the markers we proposed, they work very well for some uses, but not for all the other uses. So this more or less is our response for this criticism.
I was going to ask you about that, and I was curious to know these markers. Do you have examples of what they are, the main ones?
And so we did some analysis with Brazilian data. Barry Popkin did with the food supply in the US. There's Jim Adams did it for UK. And in these simulations of trying to simplify the list of markers without losing too much UPFs, uh, the, when you use flavors and colors and artificial sweeteners, I mean, you cover most UPFs because, as I said, it's very difficult to do an UPF without colors and flavors, right? And artificial sweeteners, because usually the industry wants to remove sugar because of regulation of sugar, right? But one still more interesting approach is what I suggest to the FDA is to combine the HFSS criteria, so combined sugar, salt, and saturated fat criteria, with this small list of UPF markers, and then when both in Brazil and the US, when you put together salt, sugar, and saturated fat in great amounts, of course, in excessive amounts, with the colors and flavors and artificial sweeteners, you cover 100% of UPFs. So this is this is a very practical thing, practical way to implement a regulation because you have this information, the list of ingredients, right? So
So
it's yeah.
it's simplifying it. It's not 100% perfect, but it captures the large
Yes.
majority.
Yeah.
So these flavors, colors, artificial sweeteners, it's going to be hard to find ultra processed foods without those.
Yes. Exactly.
And so you cover most of the problematic foods by doing that. So do you envision seeing something in policy that really uses this to actually discern between products that could be, whether that's a tax or a subsidy or a label or a policy for school meals or for hospital food, things like that? Is this a way to implement this?
Yes, yes, and actually, the PAHO nutrient profile model that was approved, I think, by PAHO in 2014 or 15. I was part of the group at that time, and what the PAHO nutrient profile, the criteria of PAHO nutrient profile for warning labels, for instance, is sugar, saturated fat, sodium, and artificial sweeteners. So I would say this was the first attempt to go beyond HFSS foods and going toward UPFs, right? So if if you put artificial sweeteners plus colors and flavors, I mean, then you come to this solution. And I was noticing California now, they adopted another approach, which is also interesting. They also selected some few markers of food ultra product. They didn't took everything, uh, but then they were oriented to select the worst offenders, right? So then they took, let's say, some colorants that are some evidence that they really are harmful, but for instance, not natural flavors, natural colors.
Mm-hmm.
And this is problematic because it's true that not all colors are the same, right? That again, you have some colors that are innocuous in terms of health, but they are there to hide to the consumers the absence of whole foods,
Right.
right?
There's a signal
So
still.
that's why
Yeah.
they are markers of food ultra processing. But you see, we don't need to have zero UPF consumption. I mean, we our body can adapt to some to some UPF. What our body cannot adapt is to a diet with a predominance of UPF. So
Mm-hmm.
in the case of US, if you cover, let's say, 80 or 90% of UPFs, and this is feasible, this can be done, this already is very important.
I fully agree. Simplifying it so that it's actually actionable. It's encouraging to see not just at the national level in the US, but in states. There are many states that have actually passed legislation on school meals or SNAP on ultra processed foods. So, my state of Arizona is one of them that passed. Basically, many of the states that did this, they would identify a list of ingredients like brominated vegetable oil, artificial coloring, things like that. And foods that contain those ingredients are not a part of the procurement, right? So that's, I think, encouraging to see. What about any other criticisms in that first box of the first paper of the Lancet series?
Another one is the lack of randomized control trials. So uh, this is complex. First of all, now there are four randomized control trials, all showing that when compared UPF diets with non-UPF diets, matched for sugar, salt, and saturated fat, you still have an effect, at least on energy intake, excess energy intake, body weight and fat mass accumulation. And now the last one, the last one on reproductive health. I mean, that's male reproductive health is affected also by UPFs, and this was demonstrated in a randomized control trial. And there's another fifth study. This didn't include in the Lancet paper because it's too new is about the oral diseases. I mean, gingivitis and this type of thing. So then it's not true that there's no randomizer control trials. But of course, we don't have randomizer control trials with the outcomes like cancer or heart disease because this is almost impossible because you have to follow people for it's not ethical. So what we
Costs a ton
have
of money. Yeah.
yeah, and what we have are precursors of chronic diseases, and this is probably what we will have in the future. And we recognize again in the Lancet paper the need to have more studies on precursors of chronic diseases. But what we have up to now confirms the association, the observational studies. Uh, and it's not true that the gold standard for diet chronic disease relationship are randomized control trials. The gold standard are long duration, large long duration, well controlled for control, robust control for confounders of cohort studies. And what we need then is to confirm with randomized control trials the association between UPF and precursors of disease. And we still don't have studies for all outcomes, but our point is that what we have up to now is enough to make clear policies are necessary, action is necessary. So
Right.
this is the. Let me see if there's another one. So control trials, UPF subgroups, identification of UPFs, and maybe there's another one.
Well, the first one we talked about was the unhealthy foods and healthy foods. So they contain healthy foods, and then some unhealthy foods are also included.
Yes,
Right.
yeah, I think this is
Yeah.
this
So
is
okay, so it sounds like paper one gets into the controversies, not just the controversies, the criticisms, and you sort of respond to each of them, which I think will just be fascinating. So if you're listening right now, you can go ahead and check those out online. I can put a link in the notes. I think your point is really important that we do have now 5 RCTs with a lot of outcomes. And we will keep building the evidence base, long duration, well controlled cohort studies, right? And confirm with more RCTs on the association with the precursors. But it's plenty enough to make policy recommendations and to start acting on this now. Because in the US, in the United Kingdom, and many other countries, we have over half of calories, well over half of calories in some contexts that are from ultra processed foods. So we need to act now. So can you tell us now about papers 2 and 3 in the series as well? Just like high level summaries, some of the key takeaways for us.
yeah. No, but before this, I think there's another argument for policy action, which is very important, is the fact that we are talking about a family of products whose consumption is increasing globally. So then it's true that we have 60-70% of calories from UPFs in the US and the UK, but and this is an important part of the paper one, which is the fact that we have 9 countries with repeated national dietary surveys showing in China, for instance, in 15 years, China went from 3% to 10% of calories from UPF. So then this makes urgent, not only necessary, but urgent intervention. So I think this, because I mean, some people say, well, but it's just UPF's the problem. What about street foods, contaminated foods? Yeah, of course. I mean, you have other problems, but are these foods, are the consumption of these foods increasing? No, on the contrary, they are being
Yeah.
replaced by UPFs.
You have to look at the future where we're headed. And when you look at the global data from Euromonitor in terms of purchases, the rate of increase of ultra processed foods consumption in Africa, in South Asia and Southeast Asia is really skyrocketing. So while it's true that it's relatively low compared to these higher income contexts, we know what's going to happen. And of course, Barry Popkin
Yeah.
Demonstrated this very clearly with this nutrition transition. As countries, as populations gain wealth, they naturally transition to these more modern Western type diets.
So I'll say that time trends in this case are as important as the impact on health. So when you put together the impact on health and trends, then the conclusion, I mean, we need to act, and
Right.
it's urgent to act, right?
Yeah.
But you ask about paper 2 and 3. Paper 2, I'd say perhaps the most important thing. Well, one aspect we already discussed, how to identify UPFs in terms of policy actions. So then you have different situations, dietary guidelines, one thing, taxation is another thing, school meal, you have different, but there are solutions for this to simplify the identification, to make it feasible in terms of regulation, because in regulation, you can have, let's say, you can say, I'm identifying 95%. No, I mean, really everything you have to be sure about what has to be regulated and what won't be regulated. So this is also important. Another important thing in paper 2 is recognize what I said before. UPFs are not the only problem, but it's the increasing problem, right? Processed foods, I say traditional processed foods. If you take bread, for instance, processed bread without additives, I mean, simple processed bread, if you have too much salt, it's not good for health. And so in this case, if you have a canned food with fruits, with, let's say, 80% of sugar, of course, this is not, but as I said, this is not the problem, which is increasing. But in any way, regulation or policies or dietary guidelines, they have to be comprehensive. So, for instance, in the case of Brazil, in our dietary guidelines, we say avoid UPFs, avoid displacing traditional foods by UPFs. That's the gold message. But we also say that Nova Group 1 should be diverse. I mean, you have to combine different food groups. You can't just have vegetables or fruits, and you have to combine them. Regarding Group 2, we say use as little as possible sugar, salt, and oils. And processed food, the same thing. Use them to complement your meals, but not as the main thing.
Right.
So we never said this, UPF is the only problem. And what paper 2 emphasize is that the UPF category should be added to the present policies. So then, if in one country you already have warning labels for HFSS foods, incorporate markers of food ultra processing can be very important. It's very important. But we are not saying forget about the policies, the existing policies, and replace everything by UPF policies. But the problem is that the UPF is the novel thing, right? So then perhaps we emphasize too much UPF at the beginning because we want people to pay attention to UPFs, right? But the second paper, I think, resolved this situation in a very elegant way. I mean, proposing UPF as an addition to policies. Of course, when you have policies, because in many countries you don't have any policy about any food policy on unhealthy foods.
Mm-hmm.
So this was paper 2. Paper 3 is more about the obstacles to implement these policies. And the main obstacle are the transnational food corporations, because they are very powerful. They have they control the politicians, the Congress, the policy making people. They control the universities, the academia. So in that paper 3 discuss how we could reduce the power of this transnational corporation, how we could balance, I mean, their power with other power, let's say. And one of these is to mobilize civil society. That's very important, because um, you know take the example of Colombia. In Colombia, they create a tax on UPFs. It was the first country that created a tax on UPFs. How this was possible? With a huge mobilization of the civil society. There's one particularly association of parents of children that organized it, and they were they were at the Congress, and they talked with each congressman and women, and finally they approve it. So I think
Wow.
this is something important, and
Yeah.
paper 3 suggests many other actions that could be done to counterbalance the power of these UPF corporations.
That's so inspiring to hear those stories of, not just maybe grassroots groups, but a whole like combination of different actors working together to combat the power of industry, right? And actually get through a tax on ultra processed foods. So I really appreciate you spending so much time with me. I just have one final question.
Yeah.
So if, we talked about a lot today. If you just, if you had one thing for you wanted people to take away from this, whether those are policymakers, researchers, or the general public, what would it be?
Well, I think it's. I would have. I think I have two different message for countries in different stages of this transition, right?
Okay.
So in countries where UPFs still do not prevail, I think it, the high priority is to promote traditional diets, to promote the healthy staple foods, and and to in this case probably to regulate marketing, because in these countries it's not, because in these countries UPF not necessarily costs less, and normal food, real food are available, because I mean, you see,
Mm-hmm.
take it China, 90% of foods they eat are not ultra processed, so they are there. You have
Mm-hmm.
sellers, you have commerce, you have, so then protect this traditional food system is very important. So I think that's protect this traditional food system and regulate particularly the marketing of UPFs. I think for these countries, in terms of the countries like the US and UK, there are just a few countries. I mean, if you think in global terms, India, China, right?
Mm-hmm.
They are always starting the transition. But in these countries where the UPFs prevail, first of all, it will take time. I mean, there's no magic bullet. But if you don't start, I mean, it will be worse. So then start by doing what is possible right now. Maybe prioritizing schools, and many states are doing, uh, selecting some the worst offenders for taxation, and I think, and be patient, because this will take time, because you really need to change the whole food system in these countries, right?
Mm-hmm.
You lost traditional food system, then you need to create a new one. And this is perhaps one difference I have with colleagues in the US, including those that are studying UPFs and are contributing hugely to the knowledge about UPFs, is the fact that these colleagues in the US, and I understand, they they uh, they think, and they are right, that you can't change the food system from one day to the other, right? So then they say, well, then let's talk to the industry and see if they do better UPFs, right? So that's the reformulation thing.
Mm-hmm.
If you understand the UPF concept, it's easy to see that these corporations won't change. I mean, they voluntarily, they will not start to do. One example I have is the hyperpalatability, right? It looks that hyperpalatability is a very important mechanism to explain excess energy intake and preference for UPFs, right?
Mm-hmm.
Uh, but the fact that we know this mechanism, this doesn't mean that you'll be able to convince the corporations to make less attractive foods, less palatable foods, right? Because again, this belongs to the UPF business model.
It's how they make money.
Exactly.
Yeah.
So it's and I think this, and one explanation for this is that, and I can understand. I mean, if I was a scientist in the US, I would like to have a solution, a quick solution for this, because the epidemic you have of obesity, diabetes is dramatic, is catastrophic, right? But the problem is that these countries were evolving in a way, they were in a trap, right? You say this, it was, the country was caught by
Mm-hmm.
these problem, and you have to be patient and you have to start. And because the problem is that, because people don't see a short-term solution, they are looking for a wrong solution. So I think that's the, don't trust in reformulation. I think that this would be my my advice.
Wow, I really appreciate that. I agree with you fully. So I'm glad you're spreading that message. So if you haven't already taken a peek, go ahead and go to the Lancet and check out the ultra processed foods and health, human health new series that's out today. And Dr. Carlos Monteiro, thank you so much for taking the time to speak with me. It's been a real pleasure.
Thank you, Ty. My pleasure. Bye bye.